the pandemic is a tragic event, but it's also an opportunity for changing our normal point of view on the reality.
We thought, with Chris Christian, the editor of the journal, that this was a crucial time, for the practice of psychoanalysis, and that, it really was going to have an effect on the whole society as well as the analytic process. And we really wanted to see how well we could document this and what were different people's experiences.
It made me feel at times dubious about whether or not I was going to be able to help other people.
I have a method to help someone who says, should I take this job or that job? But when it comes to those questions which gripped our minds in 2020, I didn't feel like I had any kind of method. So that was something that I felt all the time, and it changed my relationship to my practice, and it changed my relationship, of course, to my daily life.
I went back to my analysis. I started to go to groups, to talk to people. I didn't isolate. That's the worst thing you could do. And then it came through, the relationship became more, especially the first months, more informal.
I don't know if you have this, Patricia, but recently patients say, "How are you doing?" at the beginning of sessions in a way that they never did or wouldn't. And I don't mind that moment of connection, but I've been trying to understand what it's doing there, what they want in that moment.
It's not only a hi, how are you, how are things going? Do you have COVID or not? Are you healthy? Are you gonna be there for me? So I felt that I had to answer.
Whether the Trump government or COVID or climate change and so on, these all are extremely moving events, and you can't pretend that they belong to the patient. And so that sets up a whole group of questions like, when do I talk about myself? If not, the whole situation starts to collapse of its own weight. In the article, I frame this as the tension between being a citizen and being a psychoanalyst.
But I also think it may be that there's something about the isolation that is promoting more personal exchange, more sort of human encounter.
These analysts were saying that their patients told them that they felt more human for the first time human to them. There must be something that we're doing wrong, such that so many patients, I've heard, make us finally feel that we're more human and we're closer to them.
The analyst asks to the patient continuously to change, but the analysts have difficulties in changing because they have theories, strong theories, and the analyst is protected by his theories. I think that the pandemic obliged us to change. The week before exploded the pandemic, a colleague had in Milan a conference in which said that it was impossible to have analysis by computer.
We are missing, I'm personally missing a lot, the presence of two bodies in a room.
Oh, I definitely miss the room. But more importantly, the physical presence of the patient, which I don't think, my guess is I'll never completely regain.
And also parts of the staging of the analytic scene, the opening the door, letting the analyst in, sitting on the chair, the analyst lying down on the couch. Many of the patients I used to work on the couch we're now working face-to-face because of Zoom.
I think at first, Blagler's idea of the analytic office being the ghost of the patient made me feel that the ghost was gone. And we had to really think about how the ghost was displaced and where it went. And in some ways, it took us a while to find back the body aspects of the body frame that I think we found to some extent through Zoom and FaceTime and even through auditory phone conversations. But it never completely came back.
I went back to work early in October, and what amazed me was the change in feeling from having worked on Zoom exclusively, and to realize that you almost forget how different it feels with them. I actually think that you do forget. You know that something's wrong, but you can't even remember what it feels like to be with a patient in a room. And that's kind of scary because it means that, there's something that can happen on Zoom where you almost scotomize the kind of effect of what it's like to be with a patient in the room and have all of that stage setting.
I, at the beginning, started sitting near the computer. So we're like now face to face, right? In a way that you would never talk to people in reality.
The thing that's unnatural about Zoom is the intensity with which you can see your analyst's face.
So they started to feel that they didn't know why, that I was like in their face, because I was literally in their face.
Let's be reminded that the issue of seeing, not seeing was foundational in the invention of psychoanalysis. Freud creates psychoanalysis. We could say that psychoanalysis started when Freud and his early patients stopped looking at each other. So I think in a way Zoom and all this situation is anti-psychoanalytic in that way, because we are constantly looking at mirages of each other.
And also one patient in a way alerted me to the problem, which is that it was very hard for her to come back and speak to me because all the anxiety and the feelings that I evoke in my person when I'm there were suddenly back. And she wanted to go back to the house. She wanted to go back to the phone and to get away from the pressures of the analytic situation that I think it's very hard to feel somehow on Zoom.
But for me, the screen is not the problem. And I think that with the screen it's possible to externalize more a kind of affectivity, a kind of more friendship in some way.
In the aggregate, I don't feel less effective, and I was sure I would be.
For example, one patient, I think the treatment was very much deepened by being on the phone, and they felt freer to talk to me about things they hadn't been able to talk about before.
The detachment of the situation has given me a certain amount of freedom in my own thinking. I think that there's been a break on absorption, given that I'm on the screen, we're on the screen or on the phone. And I think that in some ways, the freedom that comes with being a little less absorbed has probably been a learning experience for me.
In my work with the patient, we have a sort of opportunity almost to play together. As the computer was not a strange, serious thing, but a sort of a game, a play, I do say, un giocattolo. And as was possible to play you, me, and the computer.
There are a lot of funny boundary things that are going on.
We can enter inside the real life of the patient, and we can see the mother, the dog, the kitchen with everything. The work of the analyst is on emotion and on narrative. With the computer, we can add to have a sort of echographia inside what is inside the patient, what is inside the house of the patient.
I've been interested in kind of thinking in a psychoanalytic way about the pandemic, and the thoughts I've had draw on some old ideas of Freud's, this notion of what he called Nachträglichkeit in German, and in French is called après coup. And in English, there's a made-up word, afterwardsness. And the idea is that something happens in the present and it opens a historic trauma, so that it's a very non-linear mechanism in psychoanalysis. And I think that the pandemic has functioned for a lot of us, patients and analysts and citizens, as an après coup. And the earlier trauma that it opens for all of us, I think, is whatever is one's first experience of helplessness. And, you know, with people like Winnicott who've been writing about the origins of the subject and the beginnings, that we begin in a state of helplessness. Laplanche calls it the fundamental anthropological situation. And I think there's aspects of this pandemic and of environmental crises in general that opens us to helplessness.
Many analysts have talked about the fact that there's something about touching very early traumas that seems to be coming up, especially when you're in the space of isolation, as if there's nowhere to go but in and back. Kind of like, I don't know, Alice in Wonderland tumbling down the rabbit hole. And I find patients remembering extraordinary things that even if they had been in analysis 5, 6 years, 4 times a week, it's suddenly as if it's alive and it's right there.
And I've certainly noticed this with patients, all of them with very different histories, but finding themselves triggered into a lot of very early anxieties connected to their own beginnings in helplessness.
The idea that we have control in our lives is an illusion, that it's a product of a developmental achievement. And I think that that's an analytic point of view. And I think we were radically disillusioned. That's a shared experience that, oh my God, this is an illusion. We have no control. And I think a lot of people got from traumatized to deeply depressed because of that, suicidal.
Another way to think of that is that you're exposed to a kind of uncertainty which is more there than you thought it was, but a kind of subjugation to circumstances and the like that is always, in fact, a part of our lives. And I think that broke through in a way, and broke through to people who have managed to build bastions against that. And I think under those circumstances, there is a paradoxical wish to have someone like a therapist who is dedicated to you and accompanying you.
I think that psychoanalysis is the best way we have for take care of psychic suffering. And when our suffering is a traumatic experience, as this of the pandemic, I think that analysis, then to work in analysis is the same that to cook. Analysis is not so complicated. You should, with the patient, continuously cook and cook emotions, fragility, pain, regrets, but cooking, and digest.
People dream about things that are important for survival of the self, for survival, sometimes for physical survival. And when it's too great a trauma, they wake up from their dream before they go into their dreams. And so, not surprisingly, at least in retrospect, got fewer dreams. But when I did get dreams, they were interesting dreams that occurred maybe 6, 7 times, where people had a divided sense of self. They were present in 2 different ways. They were talking to themselves. They were warning themselves about dangers. They were, in some ways, restricting their impulsive sense of self so that they didn't go into dangerous situations. It was almost as if they were reminding themselves, wash your hands, put on masks.
Or in the dreams themselves, they are having fights, trying to chastise others who are not following safety protocol or So you see the traversal of the historical moment we are living.
It's been important for me to see how saturated patients are by their superegos. I mean, we know that the more isolated you become, the more the kind of noise and policeman in your head turns on in a way. And that it's a way of having a partner in your isolation and your solitude. But I was surprised by it. I mean, and I'm interested in how being together, like in the flesh, mitigates that.
This is making me think of a particular clinical example where it's striking to me that a lot of the dreams are very much about the sort of world she grew up in. And this is where the après-coup idea comes in. That is, I think there are particular reasons in this case why a lot of early trauma was kind of recalled and was back in the patient's awareness. And I think it did contribute to a tremendous sort of flourishing of the dream life. Other people, not at all.
I can tell you about one patient of briefly a dream. That kind of dream in which I'm putting things in order, but they get in disorder, disorder, she can't manage. The one thing that's in the middle of her room that's in order is her bed, which looks like a couch. This is a person I saw on the couch before, and then I've been seeing on the phone. And then she felt like a presence there, a member of her family that asked her, "Are you okay?" The one thing that was there unmovable was the process with me. It was me, and asking her how things were, you see? And that was very stabilizing for a lot of people.
Some people, I was the only person that they left their house to see. And that was really moving. It really is the commitment that you have to the work that we do. And it's very beautiful.
Perhaps the space of analysis could provide for a moment of separation from an overwhelming reality that is even making its way into the dream life. That psychoanalysis rescues the singularity of how this collective experience is lived individually in the unique way this is affecting each person.
One of the very complicated factors, I think, for psychoanalysts and therapists is the sort of unevenness of who is suffering and in what ways in this pandemic.
There were people who were, who never stopped working outside. I was privileged to be able to work in my home.
In the early days of the pandemic, we thought that death was going to make us all equal. We were all together in the pandemic, was going to affect us the same way. And now we are learning that that's not the case. The Black and brown people are likely to die 3 times more often than white people. So clearly the pandemic repeats the same inequities of society and the same structural injustices.
The idea of it being a shared trauma is true and untrue, right? There is something traumatic about what we're all living, but the levels and the differences in trauma, pain, death was very uneven across society. And I can tell you that because, I work with people of color, with people who are underprivileged.
I was shocked when I arrived to the US in the late 80s that people seemed too happy. And even in the 90s, people seemed to seemingly apolitical, especially in the psychoanalytic field. Political issues didn't seem to be a concern of the practice. And this illusion that psychoanalysis was ahistorical outside of political concern has completely disappeared. There is a very politicized discussion in psychoanalytic forums that may have been a good thing of the pandemic, that it had killed completely the idea of neutrality in the sense of not being involved.
It's interesting because many analysts complained about losing their neutrality because you could see their houses, their pets, you could hear their children, so their lives were suddenly present to the patients in ways that they hadn't expected. But you're also saying that the neutrality in terms of some ahistoricity and sort of some political neutrality has also been shaken, that the analyst can't pretend that that neutrality functions, which is important because it means that you have to rethink the frame all the time. Not just the frame under which you work or that you put with a patient, but the frame under which you're living that's informing the work that you're doing.
I think analysts and analysand are going to see them each other much more on an equal playing field and recognize how much the society affects the analytic pair, not just the patient. Of course, as I said before, you know, how each internalizes this is going to be a crucial aspect, but still there's going to be a universal experience that both are going to, I think, acknowledge in the widening field of analytic space.
And I think that that's overall a challenging but valuable, if not essential, thing for us to do. And I think with COVID and with the American political crisis, that became almost unavoidable.
The question I would like for us to think as psychoanalysis, how will maybe the pandemic improve psychoanalysis?
But my further hope is that analysts are going to go into the community. I'm hoping that will be true of psychologists and psychoanalysts, that we really expand our field of service and field of inquiry.
We're going to start a mental health a community psychoanalysis clinic, and it's going to be analytically oriented.
I certainly would think it would be wonderful if we in psychoanalysis could take this opportunity to think as psychoanalysts about climate change. And there are lots of people in psychoanalysis working on climate change and trying to understand our difficulties in taking measures to protect the environment. So I think there's lots of theory and lots of interest that I think would be very productive in psychoanalysis if we're going to be post-pandemic, which is of course a question.
For example, there is, and after I stop to play, there is an extraordinary tragedy of Pirandello, which is the Giants of the Mountains, in which there are the people in the scene of the theater, and when these people go to the beds for sleeping, from the head of these people go out some puppets. These puppets begin to play together, to dream together, to narrate each other different things. And when the people wake up, at this point, immediately they go immediately inside the head. And this permits a sort of strange but playful atmosphere. And I think that also the analysis, in the analysis there is the question of the pain in this moment is a tragic situation. But in some way I think that this ability for playing together, playing and dreaming together is an important opportunity that I hope to be able to import, to have also in the future of my practice.